Hi everybody, it's Adam and I'm coming to you from the Mitral Conclave in New York, and I'm thrilled to be standing next to Dr. Kevin Accola, who's practicing out of Orlando in Florida. And we have a question for Dr. Accola that comes in from Debbie, and she says, I was diagnosed with severe mitral valve regurgitation over 5 years ago. I'm now 42 and I have no other symptoms or health concerns. My question is, could it be possible that I will never need a repair or replacement, or is that wishful thinking?
Well, Adam, that's a great question because about 15% of women have some form of mitral valve prolapse. Sometimes it's severe, sometimes it's not. Sometimes it's just a little bit of a prolapse where the valve isn't even leaking. Unfortunately with Debbie, since she does have some regurgitation already, in all probability this may go on to progress, particularly as she ages and there's something wrong inherently with the valve that would allow the valve to become more prolapsed, and it will continue to leak. She's right on track by continuously every 6 months or 4 to 6 months getting an echo to monitor the amount of leak as well as the progression of the valve disease. We want to make sure that her left atrium doesn't begin to get enlarged. That can precipitate atrial fibrillation. We want to make sure that her ventricular function stays intact and it doesn't start to become dilated or weaker. So she's doing all the right things, Adam. I think that it's important that she stays active and that she doesn't become paralyzed by this. Because if it does progress, particularly before a lot of symptoms, I'd recommend that Debbie sees a cardiovascular surgeon and even considers, if it is a very highly likely repairable valve, that a valve repair may be in her best option. But to answer her initial question, as long as she's not having symptoms and her valve isn't leaking severely, and she doesn't have a real mechanical problem with the valve, she may be able to go for some time.
Right.
But she's doing all the right things, getting it frequently checked, staying active, continuing to watch her other health concerns, but I would continue to impress upon her that she just needs to have this followed.
Great. Well, there you have it. And Dr. Accola, I just want to thank you for all of your help and support over the years. You've done incredible things for a lot of the patients and the caregivers out there. I just really want you to know how much we appreciate your pursuit of healthy hearts and healthy heart valves.
Well, we appreciate you, Adam. All the things you've done from a grassroots manner, they want to hear from people like you that have not only experienced heart surgery, but from that side of the fence, because we can tell them statistically and from a medical perspective, but you can tell them from the heart, so to speak. So I think it's so important that they hear things from you, because you can tell them, you know, okay, this is the real deal. Regardless of statistics and everything else, you can share with them your experience. So that's huge. And I want to just thank you for doing all you do.
Thank you so much. Well, again, this is Dr. Kevin Accola, and you can learn more about him at HeartValveSurgeons.com. Thanks.